Atelectasis or collapse is loss of lung volume. This is caused by inadequate expansion of air spaces. So what atelectasis is? Atelectasis actually it's not a disease by itself. It's rather a condition that happens to the lung whenever there is loss of the lung volume. So why do you think we may have loss of the lung volume? Why do we lose the volume of our lungs? This is basically because of inadequate expansion of air spaces, which can happen because of many reasons. So if the lung is not expanding sufficiently, then this means that the blood in the pulmonary arteries will not be oxygenated, and this will result in shunting of inadequately oxygenated blood into the pulmonary veins and result in hypoxia. Look at this animation. So anything that prevents proper expansion of the lungs will result in loss of the lung volume. This is mainly due to, as I said, inadequate expansion of air spaces. So imagine if there is an obstruction here in the main bronchus, then the whole lung will be affected. Or if there is obstruction in the secondary bronchus, which goes to the upper lobe or the middle lobe or the lower lobe, then there will be lobar atelectasis. So the whole lung may undergo atelectasis, or a specific lobe may undergo atelectasis. Okay? So atelectasis is again loss of the lung volume. We can lose the volume of the whole lung or part of the lung. A whole lobe may be affected, or a specific lobe may be affected, or the whole lung may be affected. This depends on the site of the pathology and the reason why this pathology is happening, or why this loss of the lung volume is happening. So what I want you to remember for your exams is loss of the lung volume. Anything that leads to loss of the volume can result in atelectasis. So how does atelectasis look like? So this is the right lung and this is the left lung. As you can see, the right lung is expanding efficiently. The left lung is not expanding. The left lung is collapsed. So this is atelectasis of the left lung. Atelectasis can be classified into three main types. Resorption atelectasis is the first one, and this occurs when an obstruction prevents air from reaching distal airways, leading to alveolar collapse. So this is an obstruction in the airways, preventing air from reaching the upper lobe of the right lung. This will result in loss of the lung volume, inadequate expansion of the lung. So this will result in atelectasis of the upper lobe. So how does the obstruction happen? Obstruction to the airways can happen due to many causes. Aspiration, especially in children, like foreign body aspiration. Mucus plug, for example, following bronchial asthma, bronchiectasis, chronic bronchitis, or post-operatively. We will discuss these diseases later on during our coming sessions. So I don't think that you know what bronchial asthma or bronchiectasis or chronic bronchitis is, but we are going to discuss them later on. Anyways, all of these conditions can lead to mucus plug within the airways, obstructing the airways. One of the important notes that I want you to remember is that resorption atelectasis most frequently occurs post-operatively due to intrabronchial mucus or mucopurulent plugs. Okay, some of the drugs, so why this is happening? Because some of the drugs that are given to the patient during surgery can affect the depth of breathing, leading to accumulation of secretions. Okay, and due to the fact that following surgery, the patient will not be able to cough because of the pain and some of the medications perhaps, then these accumulated secretions will end up obstructing the airways, resulting in atelectasis. and this is the most common cause of atelectasis. The other cause of atelectasis is intrabronchial tumor, which may be the first sign of malignancy. As you can see here in this chest X-ray, normally the lungs are filled with air, so they appear black. But because there is no air here in the upper lobe of the right lung, because of atelectasis, there will be no air. As we said in the definition of atelectasis, it will appear as an opacity on chest X-ray. The other type of atelectasis is called compression atelectasis. So in the first type of atelectasis, which is called resorption atelectasis, there was an obstruction here preventing air from entering the lungs. The second type, the air is entering the lungs properly, but there is a pathology outside the lungs, for example in the pleural space, preventing proper expansion of the lungs, preventing proper expansion. So the air is coming in, but the lungs cannot expand because there's something in here. For example, blood in the pleural space, fluids in the pleural space, or an intra-abdominal pathology preventing proper expansion of the lungs. So in the first case, resorption atelectasis, air was unable to get in. But in the second type of atelectasis, the air is coming in, but there is something preventing expansion of the lung. For example, pleural effusions, pneumothorax, or failure to breathe deeply because of an intra-abdominal pathology, or because of ascites, which is distension of the abdomen by fluids, or bedridden patients. The third type of atelectasis is called contraction atelectasis, and this occurs when local or diffuse fibrosis affects the lung, preventing its expansion. Sometimes, in certain conditions that we will discuss later on, some pathological problems, some pathologies will happen to the lung, affecting its expansion. There's a condition called pulmonary fibrosis. There will be fibrosis here in the lungs, affecting its ability to expand. So the air is getting in properly. There is nothing outside the lungs compressing the lungs, but the pathology is within the lungs. There is fibrosis affecting the lungs expansion. And this is called contraction atelectasis. Please, I want you to note that all types of atelectasis, except when the cause is contraction, because it is permanent fibrosis. So all types of atelectasis, except contraction atelectasis, are potentially reversible. And why do I say potentially? Because you need to treat the patient promptly to prevent hypoxia and superimpose infections of the collapsed lung. So if you treat promptly, preventing hypoxia and superimposed infections in the collapsed lungs, then in the collapsed part of the lung, then this atelectasis is going to be reversible.